Alright guys, welcome back to screencast for abnormal behavior. As you can see, this selection is usually 7 to 9% of the AP test, and hopefully you're reading the OpenStax book to go along with the Barron's book. Between both of those, you should get a good idea of everything going on. The first area is going to be introduction. So we've got to try to figure out in psychology what is actually normal and what is actually considered a disorder. And disorder is marked by a significant disturbance in individuals' cognition, emotion regulation, or behavior. Now, disturbed behaviors are maladaptive, and that means that they actually interfere with a person's day-to-day life. They actually do mess up things. It's hard for them to function at times, as opposed to just being a normality, which is something that can go under, not it's there, but it's easier to control. What makes it for a significant disturbance is, of course, varied over time, because everything varies over time. One of the things we're going to look at is ADHD. Is this normal high energy or disorder? Now, a lot of you guys say you have ADD, unfortunately, but this is marked by the appearance by age 7. More than 3 key symptoms: extreme inattention, hyperactivity, and impulsivity. 11% of Americans have it, and all the causes can be extensive TV watching, video gaming. I would also like to include in genetics into this whole deal. Often coexist with a learning disorder, and it is inheritable. To understand how these disorders work, we try to understand the causes that have grown from "the devil made me do it," this is the reason for my cause, into more of a medical model, which gives us back to where we're trying to include the scientific method into our problem solving. So we try to diagnose and treat, in most cases try to cure these types of deals. While we look at these disorders, we also try to be aware of the one of my favorites, the biopsychosocial approach, in which arises that all behavior arises from nature versus via nurture. There are specific disorders for different cultures, and if you come over here, you'll start to see some of them where different types of fears that came about because of cultural fears, and all these different aspects play a part for everything. When we sit there and we're going to diagnose disorders, we're going to use the DSM-5. I think it's actually the 5 right now, or 6. I think I gave you the 6. It should be an introduction module. It should be a PDF file. So this won't be on the test for 2017, but it'll probably DSM-6 might start showing up on 2018 test. But this right here just describes the disorders and estimating how often they occur. So there are changing of classifications. There are a lot of things that change over time periods as far as what we think is a disturbance and what we don't think is a disturbance. I think in the very first one, unfortunately, I think homosexuality was considered a disorder, and thankfully we've gotten rid of that sort of concept. When we labeled all of these deals, labels matter, but do they really matter in the whole long in the whole long thing? So sometimes if you label somebody, they're always considered to be labeled. That's why I don't like to be labeled, things like that. Stereotypes linger in media portrayals. So what you see in the TV show isn't necessarily right, but you think it's right, so you're going to keep thinking that that's right. Insanity is not a disorder. It comes out of the legal system, and it's not a true medical diagnosis, by the way. Labels, bias perceptions, they can change reality. You can watch this short video on the PowerPoint. Rates of psychological disorders, they vary depending on time and place of survey. So there's different types of things that do come about. So Shanghai obviously doesn't have enough in the United States. We have a lot more. Poverty is a risk factor for a lot of these things, which you are going to see. OCD, phobias, social anxiety disorders. These are some of the large ones. Mood disorders. These are some of the large ones in the United States. 26.1% of Americans reported a disorder in 2014. Sort of an interesting little concept there. Risk factors: academic failure, low birth weight, family conflicts, so the way that you're raised, parental mental illness, personal loss, sensory disabilities, child abuse, traumatic experiences, lack of sleep. So go to sleep when you can. Some of the protective factors and things that help you out as of disorders is exercising. It does help you out, releases that dopamine. We've talked about biology, feelings of security, control, social support, work skills, self-esteem, problem-solving skills, positive parent bonding. Those are the type of deals that help with psychological disorders. We're going to go to anxiety, OCD, and PTSD. Anxiety is where you have persistent anxiety, Anxiety is unfortunately part of everyday life. It is shyness, but if you have symptoms of anxiety, you're going to worry, you're going to be irritable, sleep disturbance, it's going to be hard for you to sleep because you're going to be thinking about things too much, poor concentration, restlessness, muscle tension, and fatigue. So what you're going to see is a cyclical pattern sort of develop with anxiety, where it's going to be hard for you to sleep, and when it's hard for you to sleep, you're going to get more anxiety, which is going to make it harder for you to sleep, and it's just going to be a cyclical pattern until you can break it. There are a couple different types of anxiety disorders that we're going to look at. Generalized anxiety disorder is a person is unexplainably and continually tense and uneasy. 2/3 of these are women. It's hard for them to concentrate. Panic disorder is when somebody suddenly experiences intense dread. These are where your panic attacks come from. And phobias is they're just afraid of a situation. I have a fear of heights. You will never possibly see me on an airplane unless somebody really does something to me. Social anxiety disorder is shyness taken to an extreme. These are people who are extremely shy. And agoraphobia is a fear of crowds or wide open places, which is sort of interesting for you guys. Different types of anxiety disorders. There's two that involve anxiety but are classified separately. The first one's OCD. This is a repetitive action. You're going to continuously do something. I think one of the examples I might use in just a minute is, checking on the doors when you go to sleep, and that's okay. Checking on them 15 times in 10 minutes means that you might be a little bit OCD. PTSD, they have lingering memories, nightmares over traumatic events. Even for weeks after this, that may happen, and it's hard for them to get over it. This is where you see a lot of military people come about with OCD is most common in teens and young people. I do have a friend of mine who washes her hands probably over 100 times a day, and every time she picks up something, she has to wash her hands, and she'll admit to you that she's OCD. It's hard to function in society for some of the extreme OCD people, but most of these guys that I've encountered have been able to function. PTSD is memories that exist to protect us from the future. So they're going to sit there and they're going to try to avoid it and try to condition us to where we work on things. We're going to have poor memory, feeling flat. You're going to see this a lot of times where people who come back from the military, and they call it shell shocks, but now we're going to call it PTSD. Post-traumatic growth is positive psychological changes as a result of struggling with extremely challenging circumstances and life crises. So you can see growth over this like this. Suffering can have transformative power. Some adversity can lead to better mental health and well-being. Sometimes these are for the better, sometimes they're not. Sometimes the things for people a hard time to get over. Learning perspectives, and what we're going to understand is they have a learning idea for how we understand anxiety disorders and biological. So learning says that, something bad happened to you and anxiety develops because of that. We've learned from observing others. Our interpretations cause anxiety, and people with anxiety are hypervigilant, which is just going to bring about more. So you're going to learn to have these disorders. Biological says that people are born to fear things, and that our genetic makeup has us fearing different things because that's what we are. And in OCD, the anterior cingulate cortex is more hyper, and fears can be blunted by giving people drugs. This right here would go more towards the therapy style sessions. These treat things more with medication. Mood disorders. Let's go to the fun part. Mood disorder is something with emotional extremes. There are two principal forms. You have major depressive disorder, prolonged hopelessness, and lethargy, and bipolar disorder, which is you alternate between being really, really happy and really, really sad or depressed. Major depressive disorder occurs within at least 5 signs of depression last 2 or more weeks. These are going to be your signs right over here on the side. Adults diagnosed with persistent depression disorder are mildly depressed for 2 or more years at times. Pause it if you'd like to look at the chart, but those are going to be the things that help you diagnose whether or not someone is depressed. Bipolar disorder is where you go from happy to sad. Mania is a disorder marked by hyperactivity, wildly optimistic. That these people are really, really happy and really, really excited, and then they hit the bipolar state and they become a little bit depressed. People with bipolar are typically over talkative, overactive, little need for sleep. Their speech is loud and flighty, hard to interrupt, and devices sometimes irritating. Peter Lewison looked at all this. He summarized the facts of any depression must explain. Behavioral cognitive changes accompany depression. Depression is widespread. Women's risk of depression is nearly doubled than men's. Most depressive disorders episodes self-terminate on its own. Stressful events related to work, marriage, and close relationships often precede depression, and with each new generation, depression is striking earlier and affecting more people, with highest rates in developed countries among young adults. If you are depressed, you see where I've got a little thing right here that says there is no shame in asking for help, because it's better to get help early rather than later on. Genetic influences is that mood disorders have, through some of these studies, do run in families. If twin is bipolar, you have a 70% chance that you might be bipolar. For a major depressive disorder, you have a 50% chance that you're going to attain this. The depressed brain activity can occur during depressive states. Neurotransmitters can influence mood disorders, so sometimes they can just move off a little bit differently. Drugs can relieve depression, but excessive alcohol typically aggravates depression, and because that just brings you down. So people get upset, they go drink, and that just brings them even more down. Social cognitive perspective explores the roles of thinking and acting in depression. Sometimes these people get caught in that cyclical pattern yet again, where they rumination, where they just continue to think bad thoughts, and the bad thoughts cause more bad thoughts, and those bad thoughts cause more bad thoughts, and it's a nasty little cycle to go with it. Suicide and self-injury happens to 1 million people per year. It's 5 times greater for people who have been depressed. It's an impulsive act. It's not like they want to go home and do it, but just something that just happens impulsively. There's also a lot of social suggestion in the way we self-injure ourselves, so we do it by the way the culture sometimes, recommend. So culture has it. Elderly sometimes choose suicide as opposed to fighting an illness. I think in Colorado, they just legalized doctor-assisted suicides, and you do have self-injury, which is the NSSI. Schizophrenia is where we're going to go with next. Psychological disorder. You have delusions, hallucinations, disorganized speech, inappropriate emotional expressions, and this is an example of psychosis. Psychosis where you have no contact with reality, you experience irrational ideas, distorted perceptions, and you really have different ideas and viewpoints of what's going on. Usually in class I show the Winnie the Pooh episode where he daydreams and thinks that he's eating honey and it's really mud. Delusions or false beliefs. Someone who has schizophrenia is bizarre, they're distorted, they're a little bit differently, they're usually caused by a couple different things. They have hallucinations, which is a false sensory experience. It's not just saying you think you saw something, but you think everything has changed for you. So it's very disorganized. It's expressed emotions of schizophrenia are utterly inappropriate. They're split apart from reality, and their moderate behavior may be inappropriate as well. So they're going to look at things from an entirely different pattern. It affects 1 in 100 people. Positive symptoms are hallucinations, disorganized talking, inappropriate laughter, tears of rage, and just a lot of inappropriate behavior. Negative symptoms are toneless voices, expressionless faces, and mute bodies. So they're going to lose. They don't know how to work in a normal type of situation. Brain chemistry does happen. Dopamine overactivity happens. Excessive dopamine found in all schizophrenia people. Abnormal brain activity and anatomy. Low activity in the frontal lobes, decline in brain waves, and maternal virus during pregnancy has been also known to cause schizophrenia. 1 in 10 chance of someone becoming schizophrenia if one of their parents has it. So yet again, this is something that genetics does play a role in. Genes might predispose schizo-inducing brain abnormalities. Some of the factors that happen is if parents have it, birth complications, separation from parents, short attention span, disruptive or withdrawn behavior, emotional unpredictability, and poor peer relationships. Other relationships, we're going to get through these real quick. Somatic system disorder, this is where it's medically unexplained illness. Culture plays a part. Rare type is conversion disorder. A person experiences very specific physical symptoms for which no basis can be found. One of the ways that you guys think of this is hypochondriac. If they think they're sick, they're going to get sick, and these guys are going to miss work a lot because they really think things are happening with them. They interpret their normal sensations as symptoms of a disease. Somatic means bodily for you. Dissociative disorders. This used to be called multiple personality disorder for the dissociative identity disorder. So they have 2 or more different types of personality, and the validity sometimes comes into question because do they really have it or are they just pretending to have it? One of the personalities is usually really violent. 3 main eating disorders: anorexia, bulimia, and binge eating. These are very culture-based, how we go through it, and it's very unfortunate that people do have this. Personality disorder is antisocial personality disorder, and they have a lack of conscience for wrongdoing, even towards friends and family.